teams, Lauren and Rebecca here with Bizrok. In this week's video, we're going to talk to you about the surgical pre-op process. Now, Rebecca, we've gone to hundreds and hundreds and hundreds of practices, and it seems like everybody does something a little different, but at the end of the day, there is still a great best practice and some protocols to follow. So can you kind of walk us through what that looks like?
Absolutely. Your pre-op appointment needs to be within 24 hours of the actual appointment. So if they have an appointment on Tuesday, your pre-op would be Monday morning. The first thing you'd want to do is go over the medical history. Go over your medical history with your patient. Ask them if there are any changes at all to the medical history and or medications that they are taking, because that may affect the medicines that we're going to give them for their appointment the next day. Make sure you have all your clearance letters from all their specialists that they may see.
That's a big one.
That is a very, very big one. Make sure you're covering yourself legally. If the clearance letter is needed, please make sure you have it prior to the appointment, not just the phone call in to the specialist. Actually receive the letter itself that's signed by the doctor.
If I can, Rebecca, just kind of pause for a second, because I think you do a really good job, and I know that you go above and beyond when it comes to preparing for your patients. If you're looking a day in advance and you're still waiting on a medical clearance, sometimes there's not enough time, right?
There's not.
So do you have maybe your recommendation? Because I know that you're always looking at your schedule like weeks sometimes in advance, and sometimes people wait till the day of, which doesn't work, right?
It does not work. I always suggest knowing your schedule 3 weeks out.
Good.
That is minimum. Guys, to be honest with you, I look at my schedule probably 6 weeks out. I am constantly looking because there's always changes.
Yes.
But I always have any kind of a surgical procedure designated a certain color. That way it shows up really quick. I see it and I'm like, okay, I need to check and make sure I have all my T's crossed and my I's dotted. So make sure you're looking out in enough time to have the clearance letters in. The second thing that I would love to address that is the most important is when you're giving medications that we have cross-checked everything with their pharmacist as well, that they are able to take the medicines that we're actually giving them. So just get a verbal call into their pharmacy, ask their pharmacist what medications you're on, just to make sure that they are the medicines that are listed, and then cross-reference and tell them what you're going to be giving them. The doctor's going to know as well, but that will just help cover yourselves.
Yeah, and document it.
Document everything. All conversations that you have with anybody regarding the patient has to be documented into the chart, signed and dated.
Yes, even if you're leaving a voicemail for the pharmacist. I've always been a stickler on you just document it, otherwise it never happened.
It did not.
Which sometimes we're like, no, it did happen. Well, it didn't if it's not in their notes, right?
It did not. Who is to say that you're not going to be sick or have a sick child the next day and the day of surgery and nobody's going to really know what's going on unless it's documented. So we need to make sure the medication is followed up on, as well as making sure you have phone numbers for any emergency contacts, that those have been updated and signed by the patients. And then if we're giving medicine in the office, they need to come into the office and get their medication, but not before 24 hours prior to the appointment.
Very good.
I do get asked a lot what happens if for some reason they have to cancel their appointment. That's a great question. If they do have to cancel their appointment, I do request that the patient brings their medicine back in. And then when we do the pre-op for their next scheduled appointment, then I will give them their medication bottle back. I just leave it locked in the safe.
Okay, very good. Awesome. Any other tips and tricks on just how you stay ahead of the schedule when it comes to preparing for that day?
Yes. So staying ahead also is going over their diet and any pre-op appointment information you need to give them. Make sure there are no questions. Ask them multiple times if they have any questions for you and or the doctor regarding their appointment, and make sure you have the person that's bringing them and you double check with them as well. They don't have any questions for when they leave with the patient.
Awesome. Well, thank you so much for that help today. Guys, if you need any additional help or support specifically for your practice, please reach out to us. We'd be more than happy to help support you guys. Otherwise, as always, we can't wait to see you and serve you soon.